If you are someone that is concerned about the sun damage that you have on your skin already, or are looking at treatments that might help prevent future skin cancer, then you're in the right place. I'm Dr. Helena Rosengren, and I have been working exclusively in skin cancer medicine for the last 14 years. I have been so privileged to treat thousands, literally thousands of patients with skin cancer and sun damage, many of whom are looking at methods of trying to reverse that damage. So in this video, we are going to be looking in detail at a treatment called photodynamic therapy, sometimes referred to as PDT for short. And I'm actually going to take you behind the scenes so you can see how it's done. I particularly love taking people through photodynamic therapy if they're right for the treatment, because it actually works so effectively. Not only will it get rid of sun damage, sunspots, you know, those little pink or red scaly spots that you may have on your arms or neck and face. It is the most effective treatment, and that is confirmed by science, for sun damage. That's the first thing it'll do. But it has a rather amazing cosmetic effect too. So it promotes the production of collagen in the skin, and it will reduce pigmentation in the skin also. So a few weeks after the treatment, people look fantastic, younger, less lined, less pigmented. But the thing that I most appreciate about photodynamic therapy is that it does help prevent future skin cancer. And when I've treated people that have had a number of skin cancers excised, that need to keep on coming back with skin cancers, it is so tremendously satisfying to offer them a treatment that is going to reduce that cycle. I'm not saying that it'll prevent you ever again having a skin cancer in the area, but it will definitely reduce the number of skin cancers that you are destined to develop. And that is because it reduces something called p53 in your skin, which is a precursor for squamous cell and basal cell cancers. Simple science, proven again and again. If you think that photodynamic therapy might be something that you're interested in, having watched the rest of this video, I'd advise making an appointment with someone who practices this technique a lot, so that you can be in really safe hands. They'll want to talk to you about your medical conditions, medications that you take, also whether you have a history of cold sores, because this treatment actually can bring it out if you're prone, so you'll want to talk about preventative strategies. They will also ideally want you to have pre-treatment with a cream that will remove dead surface cells and any scale on your skin. This is called a keratolytic. It leaves skin feeling super soft. Research shows very clearly that if we get rid of dead surface cells and scale, photodynamic therapy works a lot more effectively. Come and let's have a look what we do. In the morning, you would come in to have a lotion rubbed vigorously into your skin. It's called a photosensitizer. There's a variety of them available. This then needs to absorb into your cells. It'll only absorb into damaged cells, so it can't do any harm to normal skin cells. In fact, if we rubbed this into a newborn baby, it would have absolutely no effect whatsoever. It would take, depending on what photosensitizer is used and what site we're treating, 3 to 5 hours generally for that to have soaked into your damaged cells adequately. You then return to the clinic and go under a light source that uses LED lights. The wavelength of that light is really important, so we use light in the blue or the red wavelength, and they penetrate to different depths in your skin. Some of the machines that are used actually have both red and blue light. The treatment protocol itself, the length of treatment varies according to the machine that is used. It's generally 10 to 30 minutes. For ourselves, we use both red light for 10 minutes and then blue light for 10 minutes. And throughout the treatment, we would recommend that a nurse is present that you're able to communicate with if it's uncomfortable. And they will do their very best to put you at ease. Also using a spray if there are areas that are particularly uncomfortable to reduce that. Now, immediately following the treatment, the skin is of course quite red. However, the nurse will normally do something to soothe that skin. We tend to put cold compresses on the skin initially and then rub in a soothing ointment. That'll get it feeling comfortable very quickly. You do need to prepare for this, so you do need to make sure that you can stay at home for a few days, stay inside. It means taking time off work, and provided you do that and don't need to go out into the sun, the recovery phase is actually fairly straightforward. Most people find it quite pleasant, in fact, while they sit at home watching videos, reading books, applying ointment, staying in air conditioning, maybe using ice packs from time to time. We always offer assistance around the clock, so that ideally you should have a phone number that you can call if something unexpected happens. And we would always review 48 hours following the procedure, which is generally when the skin is at its reddest, and just once in a while we need to prescribe an antibiotic script, but generally there's nothing more to be done. It's just reassurance, and the recovery is fairly quick from here. At 4 to 5 days you will peel, and at 8 to 10 days that process is totally complete, revealing beautiful, soft, smooth skin with far less sun damage. Second treatment, however, will be necessary, and we highly recommend this. It's really clear from the research that having 2 treatments not only gets rid of a lot more sun damage, but it is what really helps to prevent that future skin cancer. So if you're taking the time and the trouble to invest in your skin with having photodynamic therapy, I cannot stress the importance enough of having the 2 treatments. If, having watched this video, photodynamic therapy is something that resounds with you, then you might want to go ahead and see a reputable doctor for a further assessment and treatment. So we of course would love to help you if you live in the Townsville area or are happy to travel, but otherwise try to find a clinic in your area where they can really cater for your needs and answer your fears and hold your hand through the treatment. Our contact details, if it's at all helpful, are below, and we would love to see you. Thank you.